Hey, this is Ming here, a speech therapist from agentsofspeech.com. Today, I want to talk about speech versus language or, delay and disorder, all these terms. I mean, there are loads of diagnostic terms out there, many different terms that will make your head spin. And I'm sure you're only on this video here because you've been searching about it. So let's get right into it, okay? So speech versus language. So speech is the sounds that I'm making right now that you can hear and understand. That's speech. Okay, there are some times when we pronounce words in a wrong way sometimes. So for instance, a child has a speech problem, most probably is that they cannot pronounce certain sounds, okay, or make certain sounds. Produce is the word that we use a lot as therapists. And if they cannot produce like an S sound and their name is Stacy, they will probably call themselves something like Daddy, okay? That's like they make the S into a T, and that's what we call a stop. All these things you have to see a speech therapist in order to help your child, to assess your child, right? To know what kind of speech problems there are. So speech are the sounds, okay? Nothing to do with the message within. The message within is the language. So for instance, I can pronounce all my, my accent might be really off. I might be pronouncing all the sounds incorrectly. I might be like using, like if I'm saying this, right? The TH, I might become like an F, like fis or vis or whatever, turn into a V. Then you still understand the message, it just doesn't sound correct, okay? You still understand that. So that's the language part. And language doesn't only include speech. It includes other things like what I'm doing right now, my hands, right? My facial expression is also language, right? My eye contact, when I look at you, I'm giving you some sort of message, okay? So language is all about the message that I'm trying to bring across to you, like to convey to you. I can use different methods, be in written form, it could be in like signing, it could be anything, all right? And that's something you have to be aware of, the difference between speech and language. When a therapist talks to you about, we're going to work on his language, right? Don't think that, oh man, they're going to do like all the talking and everything. It might not be always about talking. It might be about different things. Okay, so that's the difference between speech and language. How about delay and disorder? So delay and disorder is like a term that even like therapists are very careful in giving. Why we give this diagnosis is because a delay, to some extent, it infers the fact that, they're just delayed and they're going to catch up, right? They're following the progressive developmental patterns, right? Like for instance, turnover, being able to sit up and then can stand up and crawl or whatever. That's a typical developmental, chronologically speaking. That's how children grow up, right? And if you talk about language, yeah, we also have milestones for that. So speech, we also have milestones. So when you see a child hitting some milestones, but they're not chasing up to their peer groups, that might be a delay. Like the order is correct, but they're not up there yet, it might be a delay. What constitutes a delay is at least 6 months. So let's say if your child is at 1.5 years old, right? And they aren't able to say any single words, then that might be a delay already. Or maybe if they're 2 and they only speak like 1 word, then yeah, that's a delay already, right? So what is a disorder then? Disorder is something that we call when there is a disorder, meaning something that's out of order, right? So for instance, a child can do something very well, but yet unable to do something else. So in a previous video, we talked about how a child can use words for certain things, right? For reciting songs or whatever. But when it comes to talking to a person, right? When it comes to communicating their needs, they still use their hands to pull towards something. To some extent, that might be considered a disorder. Whilst these two terms are getting muddled up in modern day because therapists like myself, we don't want to infer that it's a delay and they can catch up and therefore we have more responsibility. That's just how the world works with professionals. We want to just like, I don't want to take as much risk with my wordings, right? So that's just the fact, man. I mean, whatever we try to do, we try to be conservative, okay? And that's the difference between delay and disorder. Obviously, there's a lot more things you have to do in terms of like assessments and everything to see the difference of which, okay? Also, if your child is already having a different disorder, it might be autism, might be ADHD, might be whatever, automatically it might already constitute a language disorder as well because of that disorder that they already have, right? So I don't want to confuse you anymore. There are loads of diagnoses out there. On top of my head, there's a few within speech. There's like phonological disorders, articulation disorders, there might be like dysarthria, apraxia, whatever, that are a lot more rare. And, you know, like parents are always asking me about, oh, does my child have apraxia, have dysarthria, have, you know, like, is it a phonological thing? I don't know. You have to see your local speech therapist. They have to sit down and do an assessment in order to tell you. Okay. So about all this, why does all this diagnosis and everything matter? Okay. First of all, number one, of course, you want to know what your child has. Okay. And to me, that's fair enough. That's a fair point. But at the same time, for me, at the very least, having a diagnosis, an accurate diagnosis about speech is very important, okay, about speech. Because if a child can produce or cannot produce some sounds, there must be an underlying reason behind it. And the treatment needs to be pinpoint at the reasons why. So for example, going back to the notion of saying, okay, let's not say the S, let's say the L sound, like a very common mistake that children have, the L sound, then why is it that they cannot do it? Is it because they can't hear the difference between the L and the Y sound, like la and ya? Or is it because that it's a functional thing that they cannot put the tongue to the top of the mouth, like what we call alveolar ridge at the top, like here, all right? Is it because of that? Then the treatment approach would be vastly different, all right? So we have to know these before we do speech. Whereas in language, it's rather different because especially when we're doing speech therapy, I don't know about other types, right, of therapy. What I mean is when we're doing language, we're thinking about, okay, this is the sentence length we're trying, or these are the words I'm teaching. This is the context I'm teaching in, right? Play with cards, with like a storybook, whatever. Me knowing whether if it's a delay or a disorder doesn't matter. It does matter that like what goals I'm picking, right? But at the same time, it doesn't really matter because language is a very naturalistic thing that I am teaching. It's like the communication, the interaction between us two. I'm teaching them to play. I'm teaching them after they know how to play and know the context and everything. And I'm trying to teach them to put words in the situation. Whether if it's a disorder or a delay, the goals can be very similar and the results can be very similar. The way that I do it can be very similar because at the end of the day, I'm teaching them to communicate with me with these certain words, and I can go up and down the level, the language level, and it doesn't really matter what type of diagnosis it is in a language perspective. Okay, so I hope this video has straightened things up for you and you're looking for answers and everything. Whilst you're waiting for therapy, or you're going through therapy already, don't know what to do at home, I want you to go to agentsofspeech.com/checklist for a list of tools and toys that we recommend you to get if you're starting home therapy for yourself or you're trying to do some like home practice. Okay, so that's it for this video. I'll see you in the next one. Bye-bye.